Hi everyone, I'm Dr. Evelyn from Pasadena Animal Hospital. Let's talk about masses. So masses are described as a collection of cells, usually an overgrowth of cells. They can be present anywhere in the body, so probably what you're most used to seeing or thinking about are masses that you can feel or see on the skin. So those are one type of mass. We can have masses that can grow on the eyelids, masses in the mouth, the lips, even masses that can involve different glands like the mammary glands or masses involving bones. That being said, they're not all created equal. So there are different types of masses. Benign masses, which are not to be worried about and usually not going to cause severe illness. The different masses called malignant masses, which are what we consider to be cancerous. And those can be worrisome in a lot of instances, but sometimes can be curable. Finding a mass on your pet is very scary, but it's really important that you routinely check your pet for any masses, growths, lumps, anything that feels unusual by just patting them down. Maybe when you're giving them a bath, you can feel throughout their body, feel all of their skin, you can look in their mouth, look in their ears, and see if you identify anything that looks unusual. It's extremely important that if you do find something that looks unusual, whether it's a discrete mass that you can see on the surface of the skin or just a bump you feel, that you make an appointment with your veterinarian to have them examine your pet thoroughly and give you an idea of what could be going on. It's difficult to self-diagnose a mass. Even as doctors, we can only give you our best educated guess by seeing or feeling a mass. That's where we get into how do we diagnose what type of mass we're dealing with. Typically what we're going to recommend, depending on the location and the ability to get a sample, is we start with getting a sample with a needle, what's called a fine needle aspirate. So we take a needle with a syringe, we put the needle in the mass and we aspirate to remove some of the cells from the mass, put that on a slide, send it off to the lab and have the specialist look at it to identify the types of cells involved and if we should be worried about a potential cancerous mass. About 70 to 80% of the time, we can obtain some type of diagnostic sample when we perform a fine needle aspirate and cytology. In other instances, there are tumors that might not release cells easily, in which case we may have to get a biopsy, which is a full tissue sample, in order to get a diagnosis. Typically, we start off with a fine needle aspirate because it's a less invasive process. This is an outpatient procedure. Usually we can do it with the pet awake and we can get results typically in less than a week. Let's talk a minute about the biopsy. So the biopsy is an actual full tissue sample. That generally requires some type of heavy sedation or anesthesia to collect a sample. If we have concerns that a cytology is not going to give us the answer because maybe the tumor is very tiny or we know that the type of tumor we're suspecting may not release cells, your veterinarian may recommend to perform a biopsy as a first diagnostic tool. Biopsy samples usually yield results within about a week or so, depending on the type of tissue we're submitting. Some tissue is more difficult to process and may take a little bit longer. Depending on the diagnosis, different treatments may be recommended. If it's a mass that's easily removable by surgery or surgery is necessary to treat it, then your veterinarian may recommend surgical removal. They may or may not recommend additional treatments based on what the biopsy shows once the tumor is actually removed. Any dog or cat can develop a mass. However, it is more common in older pets, and we tend to worry a little bit more about the possibility of malignancy in an older pet. In younger pets, we do tend to see masses as well. However, they do tend to be benign. That being said, it's extremely important that your veterinarian assess the mass, the location, give you information on what you can do about it so that we can obtain the appropriate diagnosis and give you the right treatment recommendations. Like I said, finding a mass can be very scary. However, you're doing the right thing by going to your veterinarian to get more information and find out what you can do as quickly as possible, because we do tend to see better outcomes the sooner we can diagnose a mass and address it. Thank you for choosing Pasadena.